Now we will start off with the insulin techniques. We usually use insulin pens. Nowadays insulin injections or syringes are now obsoleted. Majority in the primary healthcare you will also find there are different types of insulins in the form of pen. So you should be familiarize yourself with this pen. So first of all you need to know the different parts of this insulin. It has a cap. If you open that cap, this part is the actually the needle. This is actually the needle. The insulin pens are usually come without needle, and if you see here you will have different units. It is filled with insulin. Usually it has 250 units. So you need to see how much is the insulin does this pen has. All right. So you should know how much is the insulin inside. If you see the cork over here, the cork says that this insulin is now empty. If the cork is in the upside, you will say that it is filled with the insulin. If the cork is here in the midway or in the upway, so it should be full, or it should be in the middle, or whatever required for you. You should know that it is the required insulin is there. If you go a little up, here you see two things. One is which kind of insulin it is. Is it a mixed-tard, or mixed-tard means is a combination of short acting and intermediate acting, or just long acting, whatever it is, it should be mentioned here. Also it should be mentioned that which quantity is in the intermediate and which is the quantity in the long term. You can also observe here, if you rotate the other side, you will see that there is expiry dates mentioned. Okay. If you go a bit upward, you will observe that there are numbers here. These numbers are insulin units, and attached to these numbers you see that there is a needle, there is a pointer which is pointing that you have loaded how much insulin. If you rotate this, after the insulin numbers you have pointer, after the pointer you have this dialer. This dialer will rotate that pointer, will rotate these numbers in front of the pointer, that if it is 2, you will see 2, 3, 4, 5, you will dial it. This is called you load the insulin, how much you want to give in the morning, in the afternoon, in the later on. So you will load this insulin units, and then you will administer it. So that's about the orientation of insulin pen. All of the insulin pens look like this. They also basic components are the same. Should have needle, it should have insulin, it should have which kind of it should have the numbers, it should have dialer, and this is you press it and it will administer. You also need to observe the color of the insulin, whether is it clear or is it milky. If it is milky, that means it is mixed with intermediate and long term. So you need to mix it before you use it. You need to refrigerate it in the coolers in the refrigerator. However, once you started using it, you can use it. You can keep it in the room temperature. You don't need to freeze it every time after you use it. So once you know that now I need to administer myself an insulin, you need to prepare yourself. You make sure that you have alcohol swab, you have proper insulin pen which is filled, you should have needle, and and this insulin, is it full or it is empty, or does it covers the required amount of insulin that I need. You start off with the cleaning the hands with the alcohol, so with the hand sanitizer. Then you need to check the insulin unit present, mix the insulin, and safety check. Mix the insulin. How are you going to do that? If the insulin is mixed hard or intermediate or long acting, short acting and the intermediate acting, what you will do is you will do it like that. You can do it like this, or you can do it back and forth. This is how you can mix the insulin and make sure that the consistency is uniform. Alright, these are the two ways where you can mix this insulin. Number one. Number two is, if you are using the insulin for the first time, you first need to prime the insulin. What is that? Priming the insulin is you put the needle cap, whether is it working or not, and it should not have any bubbles. So this is the needle, and you can load it up to 2 units, and then you see that is there any bubble coming out or the insulin is actually coming out or not, so that to evacuate any bubbles in it. So you can load 1 or 2 units from the back, and then you will press from the down, and then you can see that the insulin is coming out. So this is how you make sure that your insulin is now working.
Only one time priming?
Yeah?
Only one time priming?
Only one time priming is needed, because the rest of the time it is okay. However, if you see that there are bubbles coming out, or you see that there is a bubble, then you can trickle it from the upward, and then you do priming again. Okay. Now when you start your insulin administration, you will ask the patient that I would like to, if anyone can come. First, if there is, what are the inspection sites? Ideally speaking, you need to expose it, but I am not doing it. Okay, so don't worry about that. We will be, what are the sites that are important? Sites that the important is the abdomen. Yeah. You can divide the abdomen into 4 quadrants: upper, lower, 2 finger breadth away from the belly button. It should be there. And you also need to, what are the sides? One is the abdomen, the other is the thighs. Upward, downwards, you can divide it into 4 quadrants. So you have 4 here, 4 here, and 4 here. So you have total maybe 12 sides. Here is not a good option. You can do it. Sometimes it is uncomfortable for the patients to do that here. We usually do it in front. Why? Because now it is pen, and we also need to see whether is it in the perpendicular direction or not. So it is convenient here rather than here, although it is not a contraindication to do that. So you first need to ask the patient which, yes.
It can be done any place in the 12 areas?
Any place in the 12 areas.
What's the point of dividing them into quadrants?
What is the point in dividing it?
To change every time.
To switch it. What is the importance in switching it?
I forget, but inflammation in the tissue.
Inflammation of the tissues. Okay. Anything?
Fatty tissue.
Fatty tissues, or the inflammation in the fatty tissues. Okay. Anything else?
Make like
Ah?
Make like marks, the needle. So if you change it, less mark.
Actually less trauma, but the specifically speaking, there is lipodystrophies. That lipodystrophies are actually fat accumulation, subcutaneous fats, because we are putting it in the subcutaneous tissues, and that will cause subcutaneous hypertrophy, subcutaneous fats hypertrophy, which will lead to lipodystrophies. What are these? These are fat nodules. So you ask the patient where you are actually administering. If the patient is on insulin, is a follow-up patient, you will ask the patient, okay, which kind of insulin you are using. He will say that, okay, I am using this insulin. You will see that it's a mixed hard or whatever, what is with them. Then you will ask how you are administering. This is history taking of a patient who is on insulin taking. How you what are the, where are you, how are you going to insulin demonstrate, how do you administer yourself? He will say that, doctor, I will administer here or here or here or here or here, or sometimes they say that, okay doctor, I administer here every time. This is very convenient, I do it every time here. So obviously this is the point where you want to intervene and ask the patient and educate the patient that this is not the right way, you should change your sites. Usually patient doesn't change their sites. If they don't change their sites, what will happen is, after you ask them that which site is you administer, if the patient says, doctor, I administer here, all right, now you will expose that site, and then you will see is there any tenderness or not in that area. Tenderness means local inflammation due to that site, or is there any erythema over there or not, number one. Number two is, if you find any fat nodules, so you inspect those area. This is the relevant examination of that patient. If you see a nodule, then you see that, okay, you are actually administering excessively at that site, you probably need to avoid this one. Why? Because this insulin is not very effective in those areas, because there is a fat accumulation. Insulin gathers over there and does not go inside, disseminate into the body. So you need to ask the patient. This is one risk. This is one what you can say, one factor of this patient not getting controlled diabetes. So you first need to ask the patient how you are administering, where you are administering, the site. Then you do examination site, and then you ask the patient, can you demonstrate how you are doing it. So once the patient demonstrated, or you wanted to demonstrate the patient, for instance, the patient is, for the first time doctor has prescribed him an insulin injection. So you need to educate the patient about insulin, and you make sure that the patient should be independent in administering his or her insulin, no matter how old is he or she, because this is his need. Sometimes the son is here, sometimes not, sometimes the other person has time, sometimes not, but this needs to be administered. So a patient should be independent in administering these things. So you ask the patient to demonstrate how does he do it, and then afterwards you will demonstrate how ideally you will do it. How ideally you will do it, you ask the patient, okay, you can do it over there 2 finger breadth from the belly button, number one. Number two is, for instance, doctor prescribed him 10 units in the morning, 10 units in the middle, and 10 units in the at night. So first you will load 10 unit here from this dialer. This will change the numbers, as this is the empty insulin, so you can't change it. So you will load it till 10 until in front of the pointer. So once you see that, okay, this unit is now 10, now there are 2 ways. One is you can do it like a pen, or administer it perpendicularly and use another hand to press it, other hand. The second way is you use it like this, spare your thumb, you hold it from the fingers, spare the thumbs, and then do it perpendicularly. And if you do it perpendicularly, first you will take the pinch the subcutaneous fat, whatever is the area, then you make sure that your insulin is loaded, then you will do it perpendicularly. After you put it perpendicularly, you will now press it. Once you pressed it, hold it for 5 seconds, and then you remove it, and then you say it, and then you may probably would like to see that is there any, sometimes there are small subcutaneous vessels we erode, so there is some kind of bleeding, although it's not a good sign, but usually it does not have any kind of bleeding. So you press it, hold it for 5 seconds, then you remove it. You may find a bit of bubble here or a bit of bubble over your skin. After you done it, you cover it your insulin and you cover it here in order to prevent it from the light. And you will do it same the other sides, and you change it. Maybe you can advise, by the way, after you done it, you need to throw this needle away, and you should use it the other needle, although the pen would remain the same. All right, thank you. So you will ask, yes.
What does the light do to the insulin?
It will it will do chemical changes in this, because this is sensitive to light. One. Number two is temperature. Light means sunlight. If you are in a room temperature, you don't need to freeze it, but if you are going out somewhere, then probably you need some ice packs to hold preserve this. Don't use it. We don't use it cooler. If you just take out of the refrigerator and you immediately use it, this is not required. This is actually not a good practice. It will make the insulin less effective. So it makes you make sure that your insulin is on a room temperature. This is for the pen. So the same thing, injection, load the insulin dose, 2-finger breath, hold the subcutaneous fat, hold the pen like situation, keep it perpendicular, press the dial and wait for 10 seconds. So that's about the insulin technique. You ask the patient why you are taking it, how you are taking it, where you are taking it, do the relevant examination, demonstrate how ideally you should do it, and then you will find out. I've come across a patient who has this frequent hypoglycemia, although the dose is not very much high, and then when we ask him about where she is administering her insulin, and she says that, doctor, because it was very convenient for me, I was doing it on my calf muscles, and that's actually the peripheral heart. So whatever is insulin is there going out, it will pump out to the whole systemic circulation, so it will cause her hypoglycemia. So asking the patient where is she or he is administering the insulin and what is the condition of that site is very important in order to manage your diabetes.